Hello everyone, and welcome back to our channel. Today, we're diving into a medical topic that might not be widely known but is incredibly important: chylothorax. It sounds complex, but we're going to break it down in a way that's easy to understand. So, what exactly is chylothorax? Let's start with the basics. Imagine a network of vessels in your body, similar to your blood vessels, called the lymphatic system. This system is a crucial part of your immune defense and fluid balance. It transports a special fluid called lymph throughout your body. Now, after you eat, especially fatty foods, the lymph that's absorbed from your small intestine becomes a milky white fluid called chyle. It's rich in fats and proteins. This chyle travels through a major lymphatic vessel called the thoracic duct, which runs up through your chest or thorax before emptying into your bloodstream. Chylothorax occurs when this thoracic duct is disrupted or damaged, causing chyle to leak into the space between your lungs and your chest wall, known as the pleural space. Normally, this space contains only a tiny amount of lubricating fluid, allowing your lungs to expand and contract smoothly. But when chyle accumulates here, it can cause serious problems. So, why is this leakage a big deal? Well, this isn't just a simple fluid buildup. Remember, chyle is packed with essential nutrients like fats, proteins, vitamins, and electrolytes. When it leaks into the chest instead of entering the bloodstream, your body is losing these vital building blocks. This can lead to severe malnutrition, dehydration, and a weakened immune system because you're also losing important immune cells called lymphocytes that travel in the chyle. Furthermore, the buildup of fluid in the pleural space puts pressure on your lungs. This pressure can make it difficult for the lungs to fully expand, leading to shortness of breath, chest pain, and a persistent cough. If a large amount of fluid accumulates quickly, it can even cause one or both lungs to collapse, which is a life-threatening emergency. Now you might be wondering what causes the thoracic duct to get damaged in the first place. The causes of chylothorax can be broadly divided into two main categories: traumatic and non-traumatic. Traumatic causes are the most common. This often happens as a complication of chest or heart surgery. Procedures involving the esophagus, heart, or lungs carry a risk of accidentally injuring the thoracic duct because of its location. Severe chest injuries from accidents, like a car crash or a major fall, can also tear or rupture the duct. Then we have the non-traumatic causes, which are a bit more varied. Tumors in the chest, such as lymphoma or lung cancer, can press on, block, or invade the thoracic duct, causing it to leak. Certain infections, like tuberculosis, can also lead to chylothorax. In some rare cases, it can happen spontaneously without any clear reason, which is called idiopathic chylothorax. And finally, in newborns, it can be a congenital issue, meaning they are born with an abnormality in their lymphatic system. So, while surgery is a primary trigger, it's important to know that many other conditions can also be at the root of the problem. Diagnosing chylothorax involves a few key steps. It usually starts when a person develops symptoms like difficulty breathing, a persistent cough, or chest discomfort. A doctor might first notice decreased breath sounds on one side of the chest during a physical exam. The next step is typically a chest X-ray or a CT scan, which will show the fluid buildup in the pleural space, an effect known as a pleural effusion. But just seeing fluid isn't enough. We need to know if that fluid is chyle. To confirm the diagnosis, a procedure called thoracentesis is performed. This involves using a needle to draw a sample of the fluid from the chest. The collected fluid is then sent to a lab for analysis. If the fluid is milky white and has high levels of triglycerides, a type of fat, it strongly indicates chylothorax. A definitive diagnosis is made when the triglyceride level in the pleural fluid is significantly higher than the level in the blood. This confirms that the fluid is indeed chyle that has leaked from the lymphatic system. Once chylothorax is diagnosed, the focus shifts to treatment. The goals of treatment are threefold. First, to relieve the symptoms caused by the fluid buildup. Second, to stop the chyle from leaking. And third, to address the nutritional deficiencies. The initial step is often to drain the fluid from the chest. This can be done with a thoracentesis, the same procedure used for diagnosis, or by placing a chest tube that can drain the fluid continuously. This immediately relieves the pressure on the lungs and helps the person breathe more easily. Next, we need to reduce the flow of chyle to give the thoracic duct a chance to heal on its own. This is often managed through dietary changes. The patient might be put on a strict low-fat diet, supplemented with special fats called medium-chain triglycerides, or MCTs. MCTs are different because they are absorbed directly into the bloodstream, bypassing the thoracic duct entirely. This reduces the amount of chyle being produced. In more severe cases, the patient might be put on total parenteral nutrition, or TPN. This is where all nutrition is delivered directly into a vein, completely resting the gut and stopping chyle production altogether. While these conservative measures are often successful, sometimes the leak doesn't heal on its own. In these situations, more invasive procedures might be necessary. One option is thoracic duct ligation, a surgical procedure where a surgeon ties off the thoracic duct to stop the leak. Think of it like tying off a leaky pipe. Another, less invasive technique is called thoracic duct embolization. In this procedure, an interventional radiologist guides a catheter through the lymphatic system to the site of the leak and injects a special glue-like substance to plug it. The choice of procedure depends on the patient's overall health and the specific cause of the chylothorax. The prognosis for chylothorax really depends on the underlying cause and how quickly it's treated. When it's caused by a manageable issue like a surgical injury and is treated promptly, the outlook is generally very good. The leak can often be sealed, and the patient can make a full recovery. However, if the chylothorax is caused by something more serious, like an advanced cancer, the prognosis is more guarded and will depend on the treatment of the primary disease. The potential for complications like severe malnutrition and infection also plays a significant role in the outcome. This is why early diagnosis and a comprehensive treatment plan are so critical. It's not just about draining the fluid. It's about stopping the leak and replenishing the body's lost nutrients. In infants, congenital chylothorax can be particularly challenging. Newborns are very vulnerable to the nutritional and immune deficiencies that come with it. Treatment involves the same principles: draining the fluid, modifying their diet with special formulas, and, in some cases, using medications that can reduce chyle flow. Fortunately, with specialized neonatal care, many infants with this condition can recover and go on to live healthy lives. So, to recap, chylothorax is a serious but manageable condition where lymphatic fluid, or chyle, leaks into the chest cavity. It can be caused by trauma, surgery, or various medical conditions. The main concerns are respiratory distress from fluid pressure and severe malnutrition from the loss of essential fats and proteins. Diagnosis is confirmed by analyzing the fluid drained from the chest. Treatment focuses on draining the fluid, stopping the leak through diet or procedures, and restoring nutritional balance. Understanding conditions like chylothorax helps us appreciate the intricate and delicate systems within our bodies, like the often overlooked lymphatic system. It's a powerful reminder of how interconnected everything is. We hope this explanation has been helpful and has shed some light on this complex topic. If you found this video informative, please give it a thumbs up and consider subscribing for more deep dives into the fascinating world of medicine. As always, this information is for educational purposes and should not replace professional medical advice. If you have concerns about your health, please consult a healthcare provider. Thanks for watching, and we'll see you in the next video.